Well, TMJ treatment basically is the muscular complex that surrounds the joint and enables it to move and shift and function, and it's what it gets overstressed when you're clenching, squeezing, grinding, and having problems with how your bite fits. And if your joint's not in the right place, then it never gets a rest period. It's like me asking you to hold your arm up all day long. Eventually your arm's going to get sore because it can't do it, and you'll wear those muscles out. And that's what we do at nighttime. Because our joints aren't in the right spot and we clench and grind, it's making those poor muscles work overtime, and now they can't do what they want to do. They're not relaxed, and so you have these muscles starting to go in spasm just like any other muscle does in your body when it's overstressed. So the first thing you have to do is get those muscles relaxed. And the way we do that is to build splints. And splint basically is a piece of plastic that we custom design, that's custom fit to your mouth and is custom arranged and adjusted only for you and your joint, and it takes some time to do that. You can't just hand somebody a piece of plastic. It's not the magic's not in the plastic. The magic is how we adjust it and how we get it to create relaxed position for the muscles, joints, and the brain. We have to fool the brain into thinking that the teeth fit perfectly. When that happens, then the brain goes, oh, relax, and everybody relaxes, and all of a sudden we do that. And also the problem is that we're dealing with muscles that are injured and overstressed, and those don't just uninjure themselves in 2 seconds. So you have to be able to, there's some time involved in this thing. In other words, once we deliver the splint, there's usually some adjustments that go along with that splint 2 or 3 times over the course of the next month or 2, depending on how badly you're having a problem. TMJ treatment is a multi-appointment because as the muscles change, in other words, as your muscle gets more spastic and gets more affected, it shortens up. What we call it's a muscle spasm. So the muscle has to regain what we call its resting length. It has to get relaxed again. That happens over time. Well, the recovery is, everybody's a little different with that, but I tell my patients is, gee, if you've had a TMJ problem and it's been pretty severe, depending on how severe it is, that you probably should wear your splint the rest of your life, at least at night. If what your old bite and your old position was causing some of the problems, and you're doing that for 18 or 16 hours a day while you are awake, and then you sleep for 8 hours and you're not awake, and let's say you don't do it at night, but it's still 16 versus 8. So we want to try to get that clock on the other side of that, the balance on the other side. So by wearing this splint 24 hours a day, at least in the acute time when you're really hurting kind of thing, that's what we have to do. And that can last for anywhere from a week to a couple of weeks typically, to get people, depending on how badly they're hurting and everything else, and that kind of deal.